botulinum toxin, called Botox, is a material that has been known for over a century and been used for medical purposes for more than 50 years. Its initial uses were for strabismus, commonly known as a squinting eye, blepharospasm, inability to open the eyes, and cervical dystonia, wry neck. Nowadays, it is one of the most popular beauty aids in the world that keeps most people in the media world and glamour industry good-looking, wrinkle-free, and aids them in looking forever young. It's the most common treatment for facial lines. The three most common sites for injection are the glabella, vertical forehead lines, around and under the eyes, paraorbital crow's feet, and forehead areas. Common misconceptions. Botox is not used for laugh lines. One of the commonest misconceptions is that Botox injections are used for laugh lines, nasolabial folds. Laugh lines are wrinkles that form around the corner of your eyes. They are not used for laugh lines. Laugh lines are instead treated with filler injections, most commonly hyaluronic acid. It does not paralyze your facial muscles. A common misconception is that Botox actually paralyzes the muscles in the face and gives folks a mask-like face. Although with extreme amounts of Botox this can happen, most physicians strive to inject just the amount that allows the patient to have some limited activity of the muscles, thereby preserving normal facial expressions, but not so much expression that they have overactivity of the areas and resultant lines. Patients should know that Botox is not used to keep them from expressing themselves, but simply to remove lines. When done correctly, people will not notice that a Botox procedure has been performed, but simply feel that the patient looks younger. The procedure. For Botox injections, the patient is placed in a somewhat raised position on the exam table, and the areas to be injected are cleansed. A skin anesthetic cream is injected at this time. After this, the Botox is injected into the desired areas. Typical injection patterns include about 4 or 5 areas on each side of the forehead and 2 or 3 areas on either eye area. After the procedure, use your facial muscles. Patients are encouraged to use the muscles injected with Botox several times during the next several days by scowling, as studies tend to suggest that this increases the uptake of the Botox into the muscles and makes the treatment more effective. Side effects are very rare. Risks with Botox. Injections are very minor. The main risks consist of headache, pain, and flu-like illness. Side effects are rare. These complications are typically very minor occurrences and resolve in a day or so. Results within 3 to 10 days. The results post-Botox injections usually start to be noticed within 3 to 10 days or even sooner. They tend to last in most people for up to 3 to 6 months. As time passes, the muscle activity will gradually return to normal. Botox needs to be repeated post this time. Wrinkles and facial lines come back to us as they were prior to Botox injections and do not worsen if the Botox is not repeated. In summary, Botox injections are one of the true wonders of modern medicine. Botox is used in many diseases, and the use of Botox to look younger and have a face which is free of lines is set to see an exponential increase. Found our information useful? If you find the video helped you, please like it. Tell us what you think about our videos. Please leave a comment. To watch our other videos, click here. For more on your health, log on to health.india.com.